Welcome to QuickMed Academy, where complex medicine becomes clear in just a few minutes.
A stroke is something we've all heard of, right? It's a huge deal, a serious medical emergency that affects millions. But what's actually happening inside the brain? Today, we're going to break it down using an idea we can all get our heads around: a sudden, total blackout.
Okay, so I want you to imagine your brain is like a huge, bustling city. Millions of lights are on, everything's running 24/7. Now, what happens if the main power grid for that entire city just suddenly fails? That's the question we're really digging into today. So first things first, let's define what this sudden blackout actually is. We're going to look at the medical side of things and see exactly why it's so much like that city's power grid just crashing.
Right, so in medical terms, this blackout is called a stroke. And as you can see, it's all about a rapid interruption of oxygen-rich blood. See, that blood is the brain's electricity, its power source. And our brain cells are incredibly hungry for energy and oxygen. Without that constant supply, they literally start to shut down within minutes. It's why stroke is a leading cause of disability all over the world.
This quote really just hits the nail on the head. Our arteries, they're the brain's power lines. So when those lines are compromised, either blocked or damaged, the power supply gets cut and entire sections of that brain city start to go dark.
So how do these power lines fail? Well, it turns out there are really two main ways the grid can go down. And these lead to two different kinds of stroke. One's called ischemic, and the other is hemorrhagic.
First up, you have an ischemic stroke. This is the most common one by far. The best way to think about this is a blockage, like a tree falling and completely blocking a major highway. A blood clot stops the flow and boom, no power can get through. Then, on the other hand, you have a hemorrhagic stroke. This is totally different. This is a burst, a leak. The power line itself actually breaks open, and that causes a whole lot of damage as blood spills out into the brain tissue around it. But here's the bottom line. Whether it's a blockage or a burst, the result for the brain cells is exactly the same. They're completely starved of the oxygen and energy they desperately need to survive. They start to malfunction, and one by one, the lights start to go out.
So you might be wondering, if all this chaos is happening deep inside the brain, how on earth are we supposed to spot it from the outside? Well, thankfully, there are some really clear warning signs. Let's get into how to decode the symptoms of a stroke. Just like a blackout in a real city, the signs you see depend entirely on which neighborhood loses power. So if the part of the brain that controls movement gets hit, you might see sudden weakness, right? If the language center goes dark, speech suddenly becomes difficult or slurred. And vision changes can happen if the visual cortex loses its power supply. The symptoms are like a direct map to the location of the power failure. Now, I know this all sounds incredibly scary, and it is. But, and this is a huge but, there is hope. In those first critical moments after a stroke starts, it's not all or nothing. We're in a race, an urgent race against the clock to save vulnerable brain tissue.
And this is where we get to a fascinating concept called the penumbra. While one part of the brain city is in a complete blackout, that's the core damage, there's a whole area around it that's more like a brownout. The lights are flickering, this tissue is really struggling, it's damaged, but it's not dead yet. It is still recoverable. And that is the key, that struggling, flickering area, the penumbra, it can be saved. The lights can come back on. But, and this is the crucial part, only if that power supply, that blood flow, is restored as quickly as humanly possible. We're talking about a situation where every single second counts.
Which brings us to what might be the most important part of this whole conversation: your power to act. Because saving that brain tissue often comes down to one simple, incredibly memorable acronym: FAST.
Let's walk through it together. F is for face. You ask the person to give you a big smile. What you're looking for is a droop on one side. A is for arms. Ask them to raise both of their arms. Watch carefully. Does one of them start to drift back down? S is for speech. Ask them to repeat a simple sentence, like, "The sky is blue." Is their speech slurred, or does it sound strange? And the most important of all, T is for time. If you see any of these signs, even just one, it is time to call for emergency help immediately.
The takeaway here is just so powerful. Simply by knowing these signs, you can be the one who spots the brain's power failure. Your ability to recognize what's happening and act fast can make all the difference in saving that struggling brain tissue and helping someone get a much, much better outcome.
And so that's the question I want to leave you with. Now that you know the signs, now that you know what's happening inside the brain, you are empowered. You have the knowledge that could be the absolute critical first step in helping someone restore the power.